All right, so I'm Lucas and I'll be presenting on ADHD. So, ADHD stands for Attention Deficit Hyperactivity Disorder, and it's a neurological disorder which causes inattention, lack of focus, and impulsivity. You might know it as ADD or attention deficit disorder, but this name is outdated and only describes one type of ADHD. It's one of the most common mental disorders, so you probably know or are friends with someone who has this disorder. So, how is this disorder diagnosed? Well, a diagnosis is based off of symptoms occurring over a period of time in more than one setting. So, for example, it can't only occur at home, or symptoms can't only occur at school. To receive a diagnosis, a person has to be showing 6 symptoms of ADHD, or only 5 if the person is 17 or older. There are 3 types of ADHD, and the type that someone is diagnosed with is based off of the symptoms they are showing. 3 types are primarily inattentive, primarily hyperactive, and combined presentation. Combined presentation is a little more complicated to diagnose than the other 2, but I'll get into that. So the first type is primarily inattentive. This is what it sounds like. Someone with primarily inattentive ADHD has problems focusing, staying on task, organizing, anything requiring focus and attention. Symptoms of this type include someone avoiding or disliking tasks that take sustained mental effort, being easily distracted, problems with time management, and problems completing tasks. The second type is primarily hyperactive. Again, this is basically what it sounds like. People with this type struggle with hyperactivity, or basically constant movement. Symptoms of this type include difficulty staying still in their seats, excessive movement or fidgeting, and cutting into conversations, or not being able to wait their turn to speak. The third type, slightly more complicated, is combined presentation, which is a sort of fancy way of saying someone who has symptoms for both of the other 2 types. The diagnosis for this one is much more thorough than the first 2. It involves a psychiatric evaluation, a complete family medical history, questionnaires, and extensive questions about their childhood, education, and the environment they grew up in. The reason the process is for diagnosing this type of ADHD is so extensive is because other neurological disorders can be easily mistaken for ADHD. For example, mood disorders, learning disorders, substance use, and some medications. Additionally, a person can have both ADHD and one of these other disorders that mimics it, so doctors just have to be really careful about diagnosing it because someone might have, a different disorder or a combination. What is the cause of this disorder? Well, the exact cause is not known. However, evidence suggests it's genetic. We can also see some biological, physiological differences in children who have ADHD versus those who don't. For example, children with ADHD have less gray and white brain matter. Some other factors that have been linked are stress during pregnancy, exposure to substances, and low birth weight. So how is this disorder treated? Well, it's not curable, but it can be treated through therapy and medical intervention. The most common sort of medical intervention is stimulants. Stimulants increase dopamine levels in the brain. The 2 ones that are used mainly are methylphenidate and amphetamine, and these are used as active ingredients in just a lot of ADHD medication, such as Adderall, Ritalin, and Focalin. These are shorter lasting medications, typically around 3 to 4 hours, and require like a couple doses a day. Some longer lasting medications would be Concerta and Adderall effects are, which is just a different form of Adderall. These are longer lasting, about 8 to 12 hours, and they're really good for children who are trying to make it through a school day. However, not everyone reacts well to stimulants. Some people react very poorly. So there are alternative non-stimulant medications which basically lower high blood pressure. And that's how they reduce the symptoms. These medications are very short acting, and typically they require several doses a day. So, according to CHAD, which stands for Children and Adults with Attention Deficit and Hyperactivity Disorder, in 2022, about 3.5% of the population has ADHD. I know 3.5 doesn't sound like a lot, sounds like a pretty small number. However, what that comes out to is about 11.5 million people living with ADHD in the US. So, in summary, ADHD is a complicated neurological disorder that people often misunderstand or they have an incomplete picture of. It can be difficult to diagnose because it can be mistaken for other things, or sort of a person might have a combination of ADHD and other things with similar symptoms. You might know people or have friends who have this disorder. And so understanding it is really important to being able to understand those people, where they're coming from, and to be able to have a good relationship with them.